main goal of social distancing, closing schools, bars and restaurants, non-essential businesses, canceling group events, and all of us working from home is to flatten the curve, right? Meaning to reduce a sudden spike in illnesses that could overwhelm our hospitals. News 5's Jesse Schultz joining us live from her home this morning. Hi, good to see you, Jesse. So we are entering a second week of us really collectively socially distancing ourselves. When will we know if we're making a dent in flattening the curve?
Yeah, well, that's the question that so many of us who are cooped up in our own homes are asking. Just how long will social distancing really last? Well, the answer is there really isn't an answer. Experts say it could go on for several more weeks or even several more months. It really just depends on how cooperative we are when it comes to social distancing ourselves, and then in turn, how effective that is at flattening the curve. The curve is referring to how many people become infected at once. If we take no precautions, experts say that will spike and our hospitals throughout the country will be overwhelmed with sick patients. That's what we are avoiding by socially distancing. A flatter curve means around the same amount of people infected, but at a much slower rate, a rate our hospital systems can handle. And while this affects every one of our lives, no more non-essential travel, no play dates for the kids, no nights out, hours on end at home, experts say it's time for all of us to work together and do our part to flatten that curve and listen to our government leaders.
It's like stepping on the accelerator of your car. If you push down hard, you have a lot of speed right away. On the other hand, if you gradually push on the pedal, you can kind of spread out and slowly accelerate.
And the idea of flattening the curve actually came from the 1918 flu pandemic, when cities that had social distancing measures in place saw far less deaths than cities that did not. Katie?